Welcome to the training for healthcare professionals. Let's begin with the module which focuses on pain assessment care to the patients. Let's take a look at the key learning objectives. After completing this module, you will be able to identify what pain is, explain various types of pain, explain the importance of pain assessment, assess pain using pain assessment scale. What is pain? An unpleasant sensory and emotional experience associated with actual or potential tissue damage, which may or may not be visible. It is one of the human body's defense mechanisms that indicates the person is experiencing a problem. Pain is very personal, no one else feels it but the patient. It is subjective and difficult to quantify. Let's find out about different types of pain. Click the images to know more. Acute pain, generally rapid in onset, varies in intensity from mild to severe, lasts from brief period to less than 6 months. For example, pain caused due to an injury. Chronic pain. This may be limited, irregular or persistent, but lasts for 6 months or longer and interferes with normal functioning. For example, migraine headaches. Now let's see some common response to pain. Physiological. Increased blood pressure, heart rate, respiration rate, adrenaline level, blood glucose, pupil dilation, muscle tension, etc. Behavioral. Grimacing, moaning, crying, restlessness. Affective. Exaggerated weeping, withdrawal, anxiety, depression, fear, anger, anorexia, fatigue, hopelessness, powerlessness. Let's look at some factors affecting pain. Culture, family, gender, age, religious beliefs, environment and support people, anxiety and other stressors, past pain experience. Let us understand the meaning of pain assessment. It is an indicator of the existence and intensity of acute pain and any resultant discomfort or distress. Measuring pain is difficult as the symptoms are not quantifiable. The most reliable pain indicator is the patient's self-report. Let's find out why pain assessment and management is important. Consequences of untreated pain. Without proper pain intervention, pain receptors become sensitive and may cause long-lasting changes in neurons. Acute pain. Increases metabolic rate and blood clotting. Impairs immune function. Induces negative emotions. Chronic pain may lead to fatigue, anxiety and depression, confusion, increased falls, impaired sleep, and decreased physical functioning. Let's understand when and on whom pain assessment is important. Patients with acute pain should be assessed every 2 hours, plus post-analgesia, pain-relieving medicine. Patients with chronic pain should be monitored every 4 to 8 hours and post-analgesia. Different scales should be used for elderly, pediatric patients. FACE scale is the most commonly used. Let's look at various methods of pain assessment. The first method is the pictorial pain assessment scale. Pain is assessed by marking the number on the scale according to the patient's response to assess the level of pain. Numeric pain assessment scale. Pain is assessed by marking the number on the scale according to the patient's response to assess the level of pain. Note patient experience. Click each picture to know how you should assess a patient's pain level. History of pain. Gently ask questions about pain experience, how it affects his or her lifestyle or daily activities. Check if any remedies have been tried, etc. Location of the pain. Ask the patient to point to the pain location. Note it on the scale. Description of pain. Onset of the pain, when it began, if there is a pattern, or if more than one type of pain is experienced. Duration of the pain. Constant or episodic, sudden or slow onset, short or long duration. Pain should be assessed on both independent or nurse-initiated movement and also at rest. The time of the last dose of any analgesia needs to be recorded. PQRST method of pain assessment. Click each method to know more. P equals provokes. What causes pain? What makes it better? What makes it worse? Q equals quality. What does it feel like? Is it sharp or dull? Is it stabbing or burning or crushing? Try to let the patient describe the pain. R equals radiates. Where does the pain radiate? Is it in one place? Does it go anywhere else? Did it start elsewhere and is now localized to one spot? S equals severity. How severe is the pain on a scale of 1 to 10? T equals time. The time the pain started. How long did it last? Some common errors in pain assessments are relying on changes in vital signs, deciding a patient does not look in pain, knowing how much a procedure or disease should hurt, assuming a sleeping patient does not have pain, assuming a patient will tell you they are in pain. Difficulties may arise because of communication barrier, deaf, dementia, confused patients. Now let's see what points are to be noted and documented. A patient's description of pain, including duration and location of pain, for example, left frontal headache for half an hour. Time, quantity and quality. Time of onset, intensity of pain and type, for example, throbbing. Aggravating and alleviating factors. Effect of pain on activities and lifestyle. Behavioral responses. Irritability, anger, withdrawal. Disturbed sleep pattern related to increased pain at night. Always remember to complete your documentation after the procedure is done. Points to remember. Be gentle and empathetic while talking about pain to patients. Provide for privacy, for example, if the patient talks about pain felt in an embarrassing area. Someone in severe acute pain should be asked a minimum of questions. Stick to the PQRST. Psychological conditions may contribute to the pain experience. For patients who cannot verbally report pain, for example, cognitively impaired, look for cues such as restlessness, agitation, withdrawal.
This is a modified Wong-Baker pain scale. The Wong-Baker is recommended for children at least 3 years old. The nurse will explain to the patient that each face is for a person who feels happy because they have no pain or sad because they have some or a lot of pain. Children choose the face that best represents their pain, which corresponds to a numeric pain rating from 0 to 10.
I was born June 17th, 1974.
Okay, very good. And do you have any allergies?
None that I know of.
All right. Okay, so I'm just going to check the medication one more time.
Okay.
And this is my third check. Acetaminophen, the name of the medication. The name of the patient is Mark Jones. The dose is 650 milligrams. I have 325, so I'm giving 2 tablets every 4 hours, PRN, for mild pain, by mouth, and he hasn't had it since last evening. I'm just going to put it in the cup for you now, Mark.
Okay.
Okay, would you like some water with this?
Yes, if you have some, that'd be great.
Okay, and do you have any trouble swallowing?
No, I've not had any troubles.
Okay, and is the head of the bed high enough for you?
Yeah, I think I'm in a comfortable position.
Alrighty. And do you take them, I have 2 tablets, as I said. Do you take them one at a time or both together?
I can take both together. That's
Alrighty.
fine.
Okay, so I'm going to bring it up to you now.
Okay.
Here you go.
Mm-hmm.
Here's your water.
Mm-hmm.
Okay,
Thank you.
got that down okay?
Yeah, no worries.
All right. So I'm going to come back and check on you in about a half an hour to see how you're doing. But meantime, if you need anything, your call light is right here by the bedside.
Okie doke.
Okay. So don't hesitate to let us know. Are you comfortable?
Yeah, I'm just fine like this.
Okay, great.